Understanding SCDS, Information for Patients. So this explainer is actually based directly on a really helpful plain English patient sheet published by Australian Dizziness Clinics. Let's just dive right in.
If you, or maybe a loved one, were recently diagnosed with Superior Canal Dehiscence Syndrome, or SCDS, you're probably looking for some clear answers right now. For a lot of folks, just getting to this diagnosis is a super long, frustrating, and, let's be honest, kind of scary path. But today, we're going to replace that fear with pure understanding. We're going to give you a real, clear roadmap for managing these symptoms. By the time we wrap up here, you'll understand exactly why your body's been reacting the way it has.
Let me ask you something that might actually sound intensely familiar. Why do loud noises make you dizzy? Or maybe, why can you hear your own heartbeat echoing in your ear? Or even hear the astonishing sound of your own eyes moving? Crazy, right? These are highly bizarre, incredibly overwhelming symptoms. And if you've been suffering in silence, kind of wondering how passing siren, a loud musical instrument, or even just a sneeze could make the whole room spin, well, you're not alone. And you are absolutely not imagining things.
Here's the absolute most crucial point I want you to remember. Every strange symptom has one physical explanation. Seriously, take a deep breath and just let that sink in for a second. Your symptoms are not in your head. You are not losing your grip on reality. They're actually the direct, perfectly logical result of a single, highly specific, and really well-understood physical issue going on right inside your ear.
Okay, so let's break down those intense medical terms you might have seen scribbled on your doctor's notepad. If you hear your own voice, or your breathing, or your heartbeat unnaturally amplified inside your head, doctors call that autophony. Now, if a loud noise, like say a dog barking or a fire alarm, triggers this sudden wave of dizziness or nausea, that's known as the Tullio phenomenon. And if changing the pressure in your head just by coughing, straining, or lifting a heavy box makes you dizzy, well, that's called the Henneberg sign. If you're nodding along right now, recognizing your exact day-to-day struggles, you know you're finally in the right place. What's really fascinating here is just how simple the root cause actually is. Superior Canal Dehiscence Syndrome, or SCDS, is literally just a tiny gap. It's a missing speck of bone that normally covers one of the balance canals deep inside your inner ear. Honestly, the word dehiscence just means an opening or a parting. That's the whole shebang. It's not a tumor, it's not some degenerative brain disease, it is literally just a tiny, microscopic hole in a protective bony roof where there absolutely shouldn't be one. But man, that tiny gap causes some massive chaos. Normally, your inner ear has these two little windows that manage the pressure of sound waves. They keep your hearing completely separate from your balance system. But that tiny gap in the bone, it acts like a third window. Think of it like a leak in a pressurized pipe. When sound enters your ear, or when pressure builds up from a cough, that energy inappropriately leaks right through this third window and pushes directly into your balance canal. And that leaking pressure totally tricks your brain into thinking you're moving or spinning even when you were standing perfectly still. I actually want to pause all the technical talk for just a second to offer some real reassurance. Because this mechanism is purely structural, just fluid and pressure leaking through a physical gap, your symptoms are completely real, they're super physical, and most importantly, they are highly treatable. SCDS isn't some giant mystery anymore, because we know exactly how the plumbing is leaking, we know exactly how to manage it. So let's look at how this builds into your actual treatment options. We can kind of think of this as the treatment stairs, stepping you up through a really hopeful progression of management. Step 1 is simple, conservative lifestyle tweaks, things like wearing earplugs in loud environments and just avoiding heavy straining. Step 2 focuses on migraine management, because we know about half of SCDS patients also deal with migraines, which can totally make the dizziness worse. Step 3 is vestibular rehabilitation. That's a specialized physical therapy to help your brain adapt and just improve your everyday stability. And finally, step 4 is surgery. Let's actually compare those approaches so you feel completely empowered with your choices here, because you are totally in control. Conservative care doesn't close that gap in the bone, but it really helps you achieve day-to-day stability by actively avoiding your unique triggers. It's super effective for folks whose symptoms are maybe a bit more mild or manageable. On the flip side, surgical intervention is definitive. It involves a specialist actually going in and physically plugging or resurfacing that gap in the bone. That permanently stops the pressure leak and directly resolves the absolute root cause of your symptoms. And if you do choose to explore that surgical route, here is a massive dose of hope for you. 90%. That's right. Corrective surgery for SCDS achieves over a 90% success rate in completely resolving autophony, that weird echoing of your own body sounds, and that sound-triggered dizziness. That is an incredibly high success rate for any medical procedure, and it really just proves how well the medical community understands how to fix this exact third window leak. Now, if you're sitting there wondering what the surgical recovery process actually looks like, let's take away that fear of the unknown with a nice, clear timeline. The surgery itself, it usually involves just a one-day hospital stay. From there, you go into a 4-week initial healing phase where rest is your absolute top priority, just letting your inner ear settle down. By the 6-week mark, the vast majority of patients are totally ready to get back to their full normal activities. It's a structured, entirely manageable recovery. As they note in the clinical literature, for patients who've been severely debilitated by this condition, surgery is often described as life-changing. And it's really vital to remember that SCDS is not life-threatening. Any hearing loss you might be experiencing with it is usually quite stable. The long-term outlook for patients who opt for treatment, whether that's mastering the conservative management or going for the surgery, is overwhelmingly positive. You really can get your life back. So what's your next step? Well, now that you understand the actual mechanics of your condition, the whole 2 windows thing, the leaking third window, and the treatment stairs, you can walk right into your specialist's office with total confidence. We highly encourage you to download the full patient guide, maybe highlight the sections that sound exactly like your day-to-day life, and bring those specific questions to your next appointment. Partner with your doctor, knowing you've got the facts. We'd love for you to visit AustralianDizzinessClinics.com to download that free SCDS patient information leaflet and check out the full patient series. We really hope this explainer helps you take that next step. Because, if a tiny microscopic gap in a bone can cause this much noise and chaos in your life, just imagine the profound peace and quiet you'll feel when it's finally fixed. What are you going to do with all that silence? Thanks so much for watching, and take care.